it's also possible to cause hypothermia in a patient. This usually occurs very close to recovery when the animal starts to come to again. Often there's a lot of body movement that comes with that that can cause them to overheat. If they have a very heavy coat or if they're overweight, these can predispose them to hyperthermia. Some of the monitors that are used to check the patient are an ECG. There are several different kinds of blood pressure monitors. A capnograph, which checks the CO2 level. Pulse oximeter checks the oxygen saturation in the blood. Manometer keeps an eye on the central venous pressure as well. There are several different physiological parameters that can be used to monitor anesthesia and check and make sure that the animal that is under anesthesia is safe and comfortable. One of those is heart rates. A cat's heart rate should be 120 to 180 beats per minute. A dog should be 60 to 150 beats per minute. Deviations from that can be caused by drugs or pain, hypoxemia, hypocarbia, hypotension, blood loss, shock. Any of those sorts of things can speed up the heart and cause tachycardia, or slow it down and cause bradycardia. Heart rhythm is another one. Any type of arrhythmias that happen can signal danger for the patient. Again, these can be caused a lot of times by drugs, lack of oxygenation, heart disease, trauma. GDV is another one that can often cause arrhythmias. Mucous membrane color is another good way to check the perfusion of the patient. Mucous membrane should be bubblegum color, is a good healthy color. This can be checked around the conjunctiva of the eye, or inside the mouth, the tongue, the perianal area as well, inside the anus, and the vulva can also be used to check the membrane color. Icterus will show up in these areas, which is a yellow tinge to the skin. Cyanotic mucous membranes will be a blue color. This can be from lack of oxygenation. Brick red mucous membranes also signal danger to the patient. If the mucous membranes are pale, this can be from blood loss or anemia or just general decreased perfusion. CRT is capillary refill time. This should be about 2 seconds. If it's longer than 2 seconds, that means that perfusion is decreased. This can be from drugs or hypothermia, heart failure, an anesthetic depth that is too high, blood loss or shock. The pulse and blood pressure are another thing that are very good to use to monitor the safety of a patient during anesthesia. These will help to indicate tissue perfusion as well. The mean arterial pressure should be greater than 60 millimeters of mercury. If it is less than that, the patient is hypotensive and steps will need to be taken to correct that. Respiratory rate is another one. If the respiratory rate is too low, this can be from drugs. If it is too high, this can be from pain or from anesthesia that is not of an adequate depth for the procedure being performed. Respiratory rhythm should be checked as well. The character of it, the length of the inhale to exhale should be compared as well, and the regularity of the rhythm. Body temperature is a really big one. If the patient is hypothermic, this can cause a whole cascade of ill effects for the patient. Some of the things that cause hypothermia are the shaving that happens in preparation for surgery. This removes some of the patient's insulating layer and can allow them to become cold. The scrubs that are used to prepare the patient's skin for surgery promote evaporation, which will also cool the patient. The IV fluids that are used, if they're not warm to body temperature, can also drastically lower the patient's body temperature. The gas that they're inhaling from the anesthesia machine will also lower the body temperature. There are several different reflexes that can be checked while an animal is under anesthesia or starting to go under anesthesia to check their plane of anesthesia. One of these is the ear flick reflex, which in my experience works better on dogs than it does on cats. But you can touch them right at the base of their ear, and their ear will usually kind of flap. If that happens, they are possibly under light anesthesia, but as soon as they get to light to medium anesthesia, that reflex will disappear. Another one is the pedal withdrawal reflex, which is done by pinching one of the toes, and if they pull their leg up, you know that they are still feeling pain. This reflex also disappears at moderate anesthesia. The palpebral reflex is the wink reflex, which you touch at the medial campus of the eye, and if they blink, you know that they are still in light anesthesia. Again, this will disappear under moderate anesthesia. The corneal reflex is a lot more useful in large animals than it is in small animals. It's very hard to detect in small animals, but you can touch the cornea of the eye with a drop of sterile saline or something else like that, and hold the eye open and drop your drop in there. And if the cornea, the eyeball actually will recess in the orbit a little bit. This is a reflex that disappears only at deep anesthesia, so it will still be present at moderate anesthesia. The laryngeal or swallow reflex, this is usually checked when the tube is being passed, because the larynx will contract if that reflex is still present. It will go away at moderate anesthesia. Also, when an animal is recovering from anesthesia, you can watch their throat, and if you can see them swallow, you know that it's okay to take the tube out, because they will take care of any liquid in their mouth by swallowing rather than aspirating it into the lungs. Another one that's usually checked as the animal is going under anesthesia is the jaw tone. To pass the tube, you have to open the mouth, and so you can open the mouth and check the jaw tone and how light it is. Most animals will clamp their jaw shut and resist you until they're under an adequate plane of anesthesia. So that will also disappear at medium anesthesia. Eye position is another one that's checked usually after the animal has been put under anesthesia. This reflex will not be present if ketamine has been used at all. But the eye will be central in the orbit when they are awake. It will roll to a ventral medial position when they go under medium anesthesia. So the eye will roll down towards their nose and their chin area. It will go back to the center of the eye again once they reach deep anesthesia. Another thing to keep an eye on is their respiratory pattern, the character, the depth of the respiration, how much effort it takes, the regularity, the length of the inhale to exhale. That ratio should also be checked, because it will give you a good idea of how deep the anesthesia is. It's been pretty good. These are all great tools that can help to support the job of the anesthesiologist. However, these pieces of equipment can malfunction, and these parameters should be checked by hand, by sense as well, to double check that the machines are operating properly.